As I talk about this work around women and women living with HIV intervention, I want to recognize and acknowledge that while my work is talking about Black women specifically, Indigenous women all across Canada are more disproportionately affected by HIV due to colonialism, racism, and other systemic issues. I continue and will continue to work with Indigenous women to try and support them, work in solidarity with them to reduce the impact of HIV among their population, but as well as listen and sit with them. Thank you. So this project is, and I've been talking about women, and I think I have a video, so I won't talk much. It was talking about, as I've been sitting at this conference for 2 days, there's been a lot of COVID and HIV, but most of it is vaccinations, what the impact. What we've not talked about is really what was the impact of COVID on women living with HIV or on people living with HIV. So through my PhD program, I brought a number of 8 women living with HIV together to look at what has been their experiences living with HIV. I want to let you know that all these women in this video are women who work frontline in the HIV sector. So they were women who are carrying this sector every day during a pandemic, supporting other women grieving, supporting women losing their jobs, supporting women who were trying to live with COVID and could not travel, but they had their own stories about this. And that these stories are very emotional, so just, up. And their personal stories. We did this project of many months earlier this year, where we used, it's a viral interventions project. So we used self-filming. So we came together virtually over many, many hours, many, many days to talk about what self-filming means. We talked about, everybody recorded themselves. We came back together and reviewed everybody's recording. We identified themes that emerged. We went back, we came back, revised them. And finally, we hired a film student at York to put all this together, edit it into 10 minutes because we had like a lot of footage. And I have reflections questions because I just want you to watch the movie, but I need you to think about these questions as you're watching this video. And these are the most important questions to think about. I don't want you to respond to me, but as you go out and do your work and do HIV research and you interact with women living with HIV and Black women living with HIV, I need you to think about this. What thoughts or feelings came up for you when you watched this video? What issues and insights were offered in these stories that you are unaware of? And what can we do individually and collectively to address these issues? Thank you.